Welcome to NCLEX Map, your go-to source for mastering nursing knowledge with confidence. Today, we're diving into the Next Generation NCLEX, or NGN. This isn't just a new test, it's a new way of thinking like a nurse. Let's explore how each question format helps you think critically, not just test well. The Next Generation. Launched in April 2023, focusing on how nurses think and act in real clinical situations. It measures your clinical judgment, your ability to recognize cues and take safe action. Now, let's break down the 10 NGN question formats with clear examples for each. First up, we have the case study format. You'll review a patient story across multiple tabs, followed by related questions. For example, a postpartum client with heavy bleeding. Analyze her vital signs and decide your first action. This format tests your ability to apply clinical judgment in sequence. Next is the standalone item format. These are individual questions that don't connect to a case. For instance, which findings should the nurse report after IV furosemide administration? This assesses your quick decision-making skills. Then we have the close or drop-down format. You'll complete a sentence using drop-down choices. For example, the nurse should walk the infusion if the client develops walk. This measures your ability to apply clinical thinking in context. Next is the matrix or grid format. You'll see a table labeled appropriate and inappropriate. For a client with chest pain, decide which nursing actions are safe to perform. This tests your ability to evaluate multiple interventions at once. Now, let's talk about multiple response. Enhanced. This is an advanced version of select all that apply. For example, select all signs of hypoglycemia, sweating, tremors, confusion, but not dry skin. This checks your recognition of accurate findings. Next is the highlight text or table format. You'll highlight specific words or data in a patient chart. For example, highlight abnormal postpartum findings like fundus bogi, displaced to the right. This tests your ability to identify critical cues quickly. Then we have the drag and drop format. You'll drag actions to categories or put them in the correct order. For managing hypoglycemia, drag in order. Check glucose, give juice, recheck level, document. This measures your organization and prioritization in care. Next is the drop-down rationale, or reasoning format. You select both an action and a reason for that action. For example, the nurse should position the client on the left side to improve uteroplacental perfusion. This tests your cause and effect reasoning skills. Now, let's look at numeric entry. You type a number as your answer. For example, heparin 5,000 units ordered. How many ml will you give? This confirms accuracy in dosage and clinical math. Finally, we have extended multiple response. This is a larger select all that apply with several correct answers. For example, select all nursing interventions for heart failure. Monitor weight, restrict sodium, elevate legs, assess lung sounds. This assesses your comprehensive understanding of safe nursing care. Each format measures one goal: clinical judgment. Every question follows the NCSBN Clinical Judgment Measurement Model. In short, NGN checks whether you can think like a nurse before you act like one. Remember, NGN is not about memorizing, it's about reasoning. It's not about guessing, but analyzing. It's not just a test, it's a simulation of real nursing practice. Success depends on your ability to connect evidence, judgment, and action. Thank you for joining us on NCLEX Map, where nursing meets excellence. If this lesson helped clarify NGN question formats, like, share, and subscribe for more insights. Stay confident, stay curious, and keep your clinical judgment sharp. Thinking like a nurse starts here.